So, when you hear the term essential medicine, what pops into your head? Probably a list of pills or drugs, right? But it's so much more than that. It's actually a whole philosophy, a revolutionary idea in public health. It's an entire system built to keep millions of us healthy. So, yeah, let's dive in and unpack how this one big idea literally changed the world.
And that quote really sets the stage for us, because our journey today, it starts in the past. To really get a grip on the power of essential medicines, we've got to go back and see how we used to think about health, and more importantly, why that old way of thinking just wasn't cutting it anymore.
All right, let's turn back the clock, way back. Because for most of history, the way we dealt with getting sick was, well, it was a completely different world. And this really captures that old way of thinking. For thousands of years, medicine was this very personal, one-on-one thing. You've got a doctor or maybe a shaman or a priest trying to fix one sick person. The causes of disease, total mystery. People blamed it on everything. Evil spirits, angry gods, you name it. So the cures were things like rituals, maybe some charms, some pretty rough-looking surgery. The key thing here is that it was all reactive. It was all about dealing with a person who is already sick. And that brings us to the big question, the one that changed, well, everything. Look, treating one person is great. It's noble work. But what happens when a whole village gets sick? Or an entire country is facing a plague? You can't fix that one person at a time. The whole mindset had to flip, from curing individuals to protecting everyone. And that right there is the birth of what we call public health. Now, this shift didn't happen overnight. Oh no, this was a full-blown revolution, really kicking off in the 20th century. It was this radical, mind-bending idea that your health wasn't just your problem, it was our problem. It was a collective responsibility, and maybe even a basic human right. And check this out. In 1948, the World Health Organization drops this bombshell of a definition. They said health isn't just about not having a disease or a fever. No, it's about complete physical, mental, and social well-being. Suddenly, the goalposts moved. This was huge. This holistic idea, it paved the way for a much bigger vision for health around the world. Okay, so then we fast forward to 1978. This is a huge moment. You've got 134 countries meeting at this landmark conference in a place called Alma Ata. And they all agree. Health is a human right. They call for a revolutionary approach to make health for all a reality by the year 2000. I mean, think about that goal. Incredibly ambitious. And to pull something like that off, you can't just have a nice idea. You need a real practical plan. And this is that plan. These are the 8 pillars of what they called primary healthcare. This is the bedrock of that whole health for all idea. You can see it's the whole shebang: education, nutrition, safe water, the basics. But look at that last one, provision of essential drugs. That one pillar that is so important. It really became the engine for a global health revolution. So let's zoom in on that one.
Okay, so to really see this idea in action, we're going to look at maybe the single most powerful, most effective, essential medicine ever invented: the vaccine. I mean, vaccines are just the perfect example of this whole philosophy. They're pretty low cost, but the impact is massive. And the key is they prevent disease, they don't just treat it. Think about it. Instead of waiting for a house to catch fire, you're fireproofing the entire neighborhood before a spark even flies. It's public health in a tiny little vial. And this really breaks down that difference, right? The old way, treating one person at a time. It's reactive, it can get super expensive. You're basically waiting for the fire and then calling the fire department. But the public health way, with something like a vaccine, that's proactive. That's installing sprinklers in the whole building. You protect millions of people all at once, you save a ton of money, and you stop disasters before they even start. But here's the thing. Having a vaccine that works is one thing. That's just half the battle. The real question is, how in the world do you get that tiny vial from a factory, across continents, and into the arm of a child in some remote village, all while making sure it still works? Well, that takes an absolutely incredible and mostly invisible system. It's called the cold chain. And yeah, it's pretty much what it sounds like, a chain of cold places. See, vaccines are fragile. If they get too hot or even too cold, they just stop working. So the cold chain is like this unbroken lifeline of refrigerators and freezers that makes sure the shot you get is just as powerful as it was the day it left the lab. So let's follow the journey.
A vaccine starts its trip in a big, state-level walk-in cold room. It can hang out there for about 3 months. Then it moves down to the district level into a large ice-lined refrigerator, or ILR, for maybe a month. From there, it goes to an even smaller fridge at a local health clinic, also for about a month. See how it's getting closer and closer to the people, and the time it can be stored gets shorter and shorter? Okay, so for the final stretch, the vaccine goes into one of these, basically a super high-tech cooler. It's a special carrier with ice packs that keeps everything stable for just a few days. And this is where the real genius comes in. See that tiny square on the vaccine vial? That's called a vaccine vial monitor, or VVM. The little square in the middle is heat sensitive. The rule is simple. If the inner square is lighter than the outer circle, the vaccine is good. If it gets too warm and darkens, you toss it. It's so simple, but it's an absolutely brilliant, life-saving piece of tech. All right, so we've talked about the big idea, the health for all philosophy. We've seen the incredible logistics of the cold chain, but that all leads to the one question that really matters. Does it work? I mean, what's the actual real-world result of all this? Let's talk numbers. Because behind this whole invisible system, all the freezers, the coolers, those clever little stickers, are millions and millions of human lives. 1.7 million. Let that number sink in for a second. Between 2000 and 2020, that's how many childhood deaths were prevented just from the measles vaccine, and just in India. That's not a typo. 1.7 million kids who got to grow up because of this system. And remember, that's just one vaccine in one country. The global impact, we're talking tens of millions of lives saved. And that is what this is all about. This is the real, tangible result of that one big idea, that health is a human right, not some kind of privilege. This is what happens when you build systems designed to protect everybody, everywhere, not just the people who can afford it or the ones who get lucky. This is the promise of health for all in action. So that brings us to one last really important thought. This incredible system we've been talking about, the cold chain, the vaccines, it was built to fight the big battles of the 20th century, things like infectious diseases. But what about now? We're facing a whole new set of challenges, right? Chronic diseases, the effects of climate change, the threat of the next pandemic. So the question we have to leave you with is this. What are the essential medicines, the essential ideas that we need to invent for the 21st century? What's going to save the next million lives? That's the question we all need to start thinking about.